Hi, I'm Lauren Masi, Doctor of Physical Therapy and Board Certified Orthopedic Clinical Specialist. I'm also the owner and Clinical Services Director of Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about how laser therapy can relieve TMJ pain fast. So first of all, what is TMJ? TMJ is the temporomandibular joint. So that's these two joints, one on each side, of where your jaw kind of meets into your skull. If you put your fingers kind of right in front of your ears and you open and close your mouth, you'll feel kind of a hollow and a filling as your jaw moves. That is your temporomandibular joint. Now, what are some causes of TMJ pain? Well, it could be that good old, punch to the face, that good old bar fight and jaw injury directly. Otherwise, it can be something like grinding or clenching your teeth. And that alone can have other causes to it. It could be stress-induced, could be muscle tightness, and these things, chicken or the egg, I don't know which came first, but both of those can cause issues in that area. Posture, or poor posture more specifically, bad ergonomics or poor ergonomics, which is how you fit into your environment. So are you sitting at a desk kind of leaning over, jutting your chin forward, things like that, which again overlaps with posture a bit. Also dental work. Sometimes if you get caps or crowns or have missing teeth and the alignment of your teeth is off, that can put uneven pressures through your joint right there. And that joint does have a cartilaginous disc, like a meniscus that's in your knee, that's in there. So sometimes people can have that uneven wear and tear on that meniscus, or even a tear in that meniscus and cartilage in the jaw that can lead to pain. So what are some of the symptoms? How might you know that you have a TMJ disorder? Sometimes you might feel pain into your ear. You might actually think you have an earache. Otherwise, the obvious pain kind of in the jaw and face kind of area locally. You might have pain that extends down into your neck and shoulders. And again, I go back to chicken or the egg. Sometimes it's problems down in there that actually refer the pain up to your jaw. So that's where physical therapy comes into play, right? We're gonna do a whole assessment to look at all of these things. Try to figure out, do you have muscle tightness? What's causing it? Is it the poor posture, the ergonomics? I'm gonna ask you questions about your recent dental work, or even if you're feeling tooth pain. Sometimes people feel tooth pain that can be coming from a TMJ disorder because that nerve right in that area, that facial nerve and some of those nerves innervate those other parts of your face and jaw. We're also going to then decide how we're going to approach treatment. Usually it's going to start with activity modification or work site modification, desk setup. We also might have to look at your diet. Are you chewing gum all the time? Are you trying to crack into very strong, hard foods that can actually constantly shift the jaw and injure those tissues? You might pay attention to, where do you chew your food? Do you always chew your food on the same side of your jaw? Because certainly that can lead to wear and tear. So again, that full assessment, getting to the root cause, will help to guide our treatment. And then treatments can include things like soft tissue massage, joint mobilizations, stretching and strengthening, like we do for most of our physical therapy clients. Now, to get to what this vlog is really about, the laser. So again, we are lucky enough in this area to have a class 4 laser. It is a light therapy based modality that uses a little bit of warmth and heating modality to increase blood flow to the area to help it heal. And I will say this is one of the #1 areas that we are seeing the best outcomes in terms of treating and controlling pain for our clients, is using that laser. So if you are suffering from TMJ pain, please reach out today to set up your complimentary demo of the laser and to talk to a physical therapist about whether we should get you into a physical therapy plan of care as soon as possible. Some other treatments for TMJ disorders that we will point you to could include stress management strategies, including breathing techniques, yoga, aromatherapy, even massage therapy to help you relax, because again, some people might be clenching their jaw due to inherent stresses that we need to address. And lastly, we might refer you out back to your dentist. Sometimes a mouth guard is warranted and sometimes it's not. I certainly have had patients who have the mouth guard and they think that that's all they need, but if they're just clenching their jaw into their mouth guard, again, we haven't really addressed the root cause of the problem, and they might need to have a different alternative provided by their dentist, or they might have to have their dentist address a malalignment that they do have in their teeth with other dental work. So we love to work with our other providers to make sure that we give comprehensive care to our patients. If you need more information on our Class 4 laser, please reference our prior vlog entitled "How a Warm Healing Laser Can Improve Physical Therapy Results."